Thank you so much. Hello, everyone. It's really an honor and privilege to present our SDG solution in Young SDG Innovators Summit 2021. I'm Khalukar Sabir Islam, Research Associate of Research and Innovation Team, Green Delta Insurance Company, and my colleague, Ms. Nafisa Tasnim Khan, will be presenting our GDIC Peace Rejuvenator solution. So without wasting the time, let's get started. So I would like to simply just share the screen. So talking about the problems, Green Delta Insurance Company is #1 non-life insurance company of Bangladesh with a share of 12.8%. We have 432 male and 115 female employees, where 457 permanent and 90 contractual employees are working. Apart from getting premium by providing insurance service, our company think about the ultimate benefit of the internal and external stakeholders. Though our company was providing various services to the employees, but COVID-19 has bring about new problems for which we are not prepared enough. Now than ever, we need to focus on the health-related matters of our employee with prime priority. We have tried to solve how might we move toward resiliency while ensuring good health of the employees, promoting a better lifestyle for them, and ensuring their commitment towards excellence. The insurance penetration of Bangladesh is less than 1%. People here already are demotivated to join this sector. So if companies like Green Delta Insurance Company provide better facilities by securing the health of the employees, talented human resources will be attracted and will feel safe to join this sector. Moving on to the opportunity and value proposition, our prime focus is not to increase revenue through product modification, rather reducing the operational cost by providing better health service to the internal stakeholders, especially to the employees, for maintaining greater employee base. Our solution will reduce absenteeism, will make lower the employees turnover, along with lower health cost, and will increase the productivity. SDG is in the DNA of Green Delta Insurance Company. We are connected with 10 SDGs. And through this solution, we're focusing on SDG 3, health and well-being, that is aligned with our solution. Moving on to the breakthrough idea and process, through our solution, we will try to ensure access towards emergency healthcare service through telemedicine, access to regular and emergency medical facilities, access to online and offline medication purchase and consultancy support, online session to help employee with body fitness, yoga, mental health and consultancy, daycare center for female employees, access to fresh organic foods and beverage for employees. We have always tried to surprise our stakeholders with innovative customer-centric product and services by showing our footprint as a pioneer in a market. No company of Bangladesh insurance industry have ever thought that reducing operational costs by providing better health facilities may add value in company's portfolio from business perspective, and society or stakeholders will be benefited by better condition of physical and mental health perspective. On another note, we'll encourage other insurance companies of the country as well to do the same. Moving on to the business model, our solution will go in a circular model where Green Delta's employees' unnoticed health issue will be solved by partnering with our subsidiary GDIC, which is a medical assistance company, and other issues will be solved by GDIC itself. Moving on to the business model, moving on to the marketing plan, since it's an internal solution, HR awareness session can play a pivotal role here. Moving forward, social media engagement, email communication, non-financial incentives, and good health award, yearly employee incentives can play a pivotal role here. So now I would like to request my colleague Nafisa Tasnim Khan to take this forward.
Thank you so much, Sabri. As we move on, I think there is a glitch in sharing the slides. It's not properly visible. It's not in a presentable format. But yet, as we have to move on, we will see the results of solution. Hello, everyone. This is Nafisa from GDS's RNI team. Currently, the industry, uh, m- in the industry, very few market players have brought employees' health and well-being issues under the limelight. The risks of avoiding the good health and well-being issues are companies' overall performance deterioration, falling employee satisfaction, higher turnover rates, increasing costs on onboarding employees, etc. Employee-friendly practices can eye opportunities like a trend can be set employee-friendly and better work culture throughout the industry, increased employee satisfaction and poverty, of enabling facilities that can reduce employee stress level, and also addressing SDG 3, that is good health and well-being. Moving on to the next slide, we have tried to portray the project team that we need for implementing the solutions to identify good health and well-being issues of the employees. A dedicated team from HR is required to hear them out. A team will look after for administrative issues, finance and accounting will look after projects and monetary subjects. A third-party service enabler, in our case GD Assist, will create access to all sorts of medical facilities. A medical support team will facilitate all medical equipments and medicines accessibility. Lastly, there will be partners who will create access to organic and fresh foods within the office premises. Later in the financial projection and impact, before we show the financials directly, I'd like to relate the impact of addressing good health and well-being with some proven data. The key goal to address these issues are to increase employees' productivity. This eventually will in good health and well-being and employees' productivity. Absenteeism was reduced by 27% when employees healthy lifestyle. Ensuring well-being of the employees reduces turnover by 25%, increases employee productivity by 20%, increases customer satisfaction by 31%. Employees without mental health concerns have 26% increase for productivity. And these eventually will increase firms' profitability by 16%. In the next slide, we have observed a similar correlation among our employees. We have projected the investment will be about BDT 3 crore over the project timeline and expecting an average ROI to be 4%. By addressing the issues, there are certain long-term goals that GTIC is eyeing, reducing the percentage of absenteeism due to poor health condition from 1.89% to below 0.5% by 2023. Though not communicated enough in a formal way, we assume mental health issues are also responsible for this. Reducing employee turnover rate to 0%, and we will reduce the annual productivity loss per employee by 50% by that time. Finally, in the last slide, we have projected the timeline for the initiatives to be completed and be fully functional by 2023. All sorts of medical facilities and services are already in place with the help of GD Assist. By the end of the next year, we will be able to ensure women hygiene and sanitary products readily available within the office premises and establish a daycare center. Implementation of the plans to create access to organic and fresh food will start by mid next year and will be completed by the end of 2023. That's all from us. I appreciate the opportunity to talk to you today. Thank you.
Thank you. Right on time, team. Thank you so much for your presentation. And now we move to the judges to listen to their questions.
I'm going to go first then.
Sure.
One of the things I think is impressive is that there's a lot of numbers, there's a go-to-market plan, there is a lot of slides, but at the same time that also I have the feeling you have very well looked at all the statistics, all the analysis, all the impact, but at the same time, I got a bit insecure. The solution is to bring these products to the people in your offices, the women, the employees, or I was a bit lost. So that's perhaps one of the feedback I have, that it seems like we have done everything right, but I was left out a bit by the presentation, and there's many slides. So just to understand what is the problem and what is the concrete solution, very quickly.
Okay, currently we are thinking that our employees are maybe lacking motivation or something that may hamper their productivity, and we are trying to reach them to the level where their productivity will be at the best level, where they can deliver their best within the office time and giving the best to our the main goal of the company. One of the goals to attain productivity, profitability over the years.
May I also just follow up one question, because I see you mentioned daycare centers, but what I understand from my time in UNICEF, daycare centers are not very common in Bangladesh, and there are very few children in the daycare centers.
Yeah, so
in factories, for example. So how are you thinking to implement that?
okay, actually we have about a 13-14 story building. So one of the floors belong to us, and we thought of, in a corner we will have a daycare center where the new mothers will can keep their children in there, so that they can be in touch with them without having to stress about them when they leave them at home, and can frequently take care of them or feed them in middle of the days, or as they need to. I think that can contribute to their reducing their stress levels, and also continue their jobs accurately.
Nadim, do you want to go next with a question?
You can go ahead if you have something in mind already.
All right. So, I mean, for me, the key statistic that captured me was, you said in Bangladesh, there's 1% insurance penetration. Why was that not your key challenge? Because, I mean, it seems like that's a big business challenge. And if you do solve that one, you increase profitability, and maybe you can, as a result, give the ladies more leave days because the company is more profitable, and you don't have to increase productivity, but you could just increase your market share.
Oh, thank you so much for the question. So yeah, we have already mentioned our insurance penetration of the country is less than 1%. So there are lots of issues in the country. You see, we have awareness issues. People here don't take insurance positively, and we can't change this scenario over time. Here, our market is changing. We are very much corporate. We are incorporating insurtech in here. Yeah, though insurtech is very famous in Western countries and developed countries, but since Bangladesh is a almost developing countries, here we need time to cope up with the growing world. Like bank, here banking penetration is almost 17%, whereas insurance is less than 1%. So talking about the main question, why we are not focusing on increasing that penetration, we are focusing on that. We're also introducing customer-centric product. We're developing our service. But at the same time, we need to also think about our internal stakeholders, employees. Here, people are not very much positive about joining this sector. They're thinking, okay, insurance is already lagging behind. Why I should continue my career in this sector, whereas I have few other industries as well. So right now we are focusing on that. We are trying to do something better by which people also get attracted and our internal stakeholders feel safe. You see, due to COVID-19, this sector has faced lots of things, and we have also noticed nowadays health is wealth, and COVID-19 has also proved that. So now than ever, we have think about this. In Bangladesh, we have 78 insurance companies, life and non-life together, but no companies are providing this kind of facilities. For example, telemedicine service, daycare centers, and emergency medical service. We have already started this journey. When we have started our journey with this YC program, we have come up with this solution. We have just presented our idea before our management, and already our management is very much positive with our solution and welcoming this idea. So this was the main reason for bringing this idea into this solution. Thank you.
Thank you so much. Thank you. I can already see some encouragement messages in the chat box. I can also see questions. So I do encourage everyone to keep using this feature. Thank you, team.